Thank you very much, Charlie, for having invited me here. Where's Charlie? Where's Charlie? Charlie has disappeared. What I've realized is that all you need is a genius bracket and the thermal unit wire. And you can go off on a vacation after that, and the work is done. The work is done by the wire. The wire works for us. Well, that's for you. Well, we need to work. The unsatisfactory smile. What is important is to know what the patient wants, the motivation of the patient. It's an old story. Emmanuel Adjan years ago told me that we could lower the maxilla and we can rediscover a smile where there was a deficit. What is the interest of increasing the vertical dimension in these specific cases? This is what we're going to be showing you this afternoon. Be careful with orthodontic surgery. Patients must be able to recognize themselves. What is important is to modify the inclusion, but the patient need to be able to recognize themselves, and that is what will make them happy, and they will be grateful to you. If they don't recognize themselves, it's much more difficult, and you're not sure of success. It's important for them to be able to recognize themselves. Be careful with the 3D simulations. We were talking about them earlier with our friend Dr. Kelbra, but the x-rays have to be good, but the patient has to recognize himself or herself. Once again, we work as artists, and we work as people who accompany patients. You shouldn't do surgery on the patient through the x-ray and say, this is what the axis should be. You don't get very good results in that way. But from a general point of view, we have less lawsuits if you work in this way. But if you see a lot of faces, you see that you can adapt your treatment to the face that you see. And that is important. The genius bracket is wonderful, and at the beginning, I wanted to work without the brackets. It's simpler. This is a patient who came to see me for her smile. When she smiled, you didn't really see the smile. She was a class 1. She had had orthodontic treatment. She was disappointed. And what is important is to know why the patient comes to you. Is it because they want to achieve a class 1, or because they want a nice smile? What do they want from your treatment? What they're looking for is very important to know at the beginning of the orthodontic treatment, because the treatment is perfect. No criticism. She was a perfect class 1, but the patient is very unsatisfied. Why is she unsatisfied? Because her smile is not what she wanted. The practitioner didn't listen to her very well. She wanted to have a nicer smile. She thought that once the teeth were aligned, she would have a great smile, and this was not the result that she got. And it is orthodontic surgery which can improve her smile. But can we predict? So it's very important when the patient comes to see you to know why the patient comes to see you. That's very important. It could be for an open bite. You shouldn't jump at the patient and look at their mouth and say, well, we can treat you, we can treat your class 2 or class 3, we're going to treat your open bite, we're going to treat the mandible, and everything is going to be fixed. No, you need to know why the patient comes to see you. That's very important. So she had been treated. She was a perfect class 1. She had been treated normally. We had to put arches up on the upper and lower planes, and by modifying the height, you will see that the smile became very different. That's after surgery, elastics, before, after, not much has changed. Everything is identical, except that I had to remove the lower plaques because there was infection. That may happen. Both jaws were operated on, and you see that there's a modification of the occlusal plane. The maxilla was lowered, and we moved the mandible forward, and the smile has become very different. We have a smile which is the smile that the patient wanted. She wanted a normal smile, what we could call a normal smile, where you see all of the teeth. And when you don't see the gingiva, you should, before treatment, you should not show the gingiva after the procedure. If someone who has a gummy smile, obviously the gums should be visible after the procedure because that enables them to recognize themselves. So you can do surgery by enabling the smile to appear again. And it's not because they have surgery that they're going to be in a lot of pain. And you see that you increase the height of the face, and when you increase the height of the face automatically looks finer. But the nose is the same, the nose width is the same. Even if there's been mandibular advancement, when patients say that mandibular advancement widens the nose. No, this is not true. It all depends on what you do. There are a lot of patients who say, I read on the internet that if you advance the mandible, it's going to change the nose. It's going to change your nose if you don't lower the maxilla. If you lower the maxilla, the nose will be the same. I can promise to you that your nose will remain the same. The only thing that's going to change is your smile. And your face is going to look finer because we're going to be increasing the vertical height. And your face will look narrower, and you're going to age better because we're going to increase the amount of skin. And by increasing the surface of skin, the face will age better. You see that the profile is almost the same, but the smile is totally different. So you were successful here. It is dangerous, of course, to do work on patients whose smile is not ideal. On the left-hand side, the smile is not ideal, and on the right, it's much better. So you have clear results. But for most of the patients, these are patients that are referred to you, and these are patients who need an orthodontic treatment because the teeth don't fit well together. And there's always orthodontic preparation before surgery. They can be operated on at an early stage. It doesn't give you the same aesthetic result. If you want an ideal aesthetic result, it's best to do the surgery after orthodontics and keep the protocol which was established several years ago. You need to do orthodontic preparation, surgery, and a bit of orthodontics afterwards. That's how you get the best results. This is a patient from Michel Assayag. I wanted to stay with the genius brackets. That is what is important here. And so this patient could easily have been treated exclusively with orthodontics. She has a perfect profile. Occlusion from the front is okay. There's no contraction of the chin, except that she's a full class 2. She can easily be treated with extractions or with the placing of elastics without any problem, except that the smile is unsatisfactory. You see here the brackets. So what is the patient's motivation? The patient's motivation is the smile because she can't smile fully. And if you want her to smile fully, she needs surgery. The American smile is fashionable. You should extract as little as possible. The teeth should be spread as much as possible. The upper lip should be sufficiently developed. And if you want to do that, you need to advance the mandible, and you should lower the maxilla and advance the maxilla if you want the teeth to show more. So you have a more harmonious smile. While having kept all the teeth, and we've treated the patient in a more classical way by aligning the upper and the lower teeth, and we've lowered the maxilla, we've also advanced the maxilla. The mandible. So, no orthodontic treatment. This patient is a class 2. She thought she had prognathism. She'd had orthodontics, but again, the orthodontist hadn't really listened to what she wanted. She wanted her teeth to show more, the upper teeth, of course, not the lower ones. You see the lower ones more than the top ones, the upper ones. And she didn't want to look as if she had prognasia. What did the orthodontist do? The treatment is perfect. No criticism of the treatment, but implants were placed, which further solves the problem. Even with corticotomy, it's difficult to move the implants, so it's difficult to know what to do. The patient comes to your office who has a perfect class 1 implants and a not very good-looking smile, and who has a class 3 look. Why did she come? She looked as if she had prognasia, and you didn't see her upper teeth, so she wasn't fully crazy. And the reality was this. Theoretically, we should transform class 1 into class 3 to do surgery, except that implants prevented that. If you remove the implants, there's going to be a hole. If there's a hole, you can't move the teeth, or you need a graft. It becomes very complicated, and you're not sure that you're going to manage. So I sent her to the orthodontist. I was the same one. He did indirect bonding, and he glued the brackets, and I said, we're going to do surgery. And he said, I don't know what you're going to do with this patient. It's going to be complicated. It's not very pleasant when the orthodontist calls you the day before surgery and says, I don't know what you're going to do with this patient. So she had a splint. She was class 1. And I did surgery on both jaws. Now, you don't necessarily need to do dramatic surgery and advance in a very large way to get a change. You can get a modification by simply slightly changing the occlusal plane and lowering the maxilla, and this is what we did. We did surgery on both jaws, and you see that the patient has a finer profile. When you take the pictures, first of all, it has to be the same camera, same distance, and the patient has to have exactly the same position, the same posture. You can take a patient with wide face. If you shift the position of the face just a little bit, the face will look narrower. So this you need to be aware of. Your patient, when the first picture is taken from the profile and from the front, there's a large modification in the aspect of the face if you shift very slightly. So there's not much change, but except that when she smiles, you no longer see her lower teeth, you see the upper teeth, and that is what she wanted. And so there was surgery on both jaws. Now, sometimes, very often there's an orthodontic treatment. You see here the position One picture is taken with her head in one position, and the head is taken in a different way. The smile is totally different. We could have had done surgery on the mandible exclusively to treat class 2, and that was done. Same thing here with this patient, before and after. And this patient had surgery on both jaws, and there was a slight tilting of the occlusal plane, and the result is totally different. You see here that the smile has changed completely. You see her teeth when you couldn't see them on the left. And from the profile, the patient looks much younger. Patient looks younger not through the smile, but by increasing the face height and by advancing it. The double chin has disappeared. The nose hasn't changed much, contrary to what you read on the internet, which isn't quite true. It's true if you don't lower the maxilla. So it's very important to know when people say something, they only have part of the information, but it is important to know why the patient comes to you, why they come to you, and what they've read on the internet, because they've all read things on the internet, practically all of them. And you see that the smile has changed completely with this bimaxillary surgery. Here again, surgery on both jaws. Another patient of Michel Assayag, class 2, retromandible. The smile was not satisfactory, and we tried to fix that by increasing the chin height. And so there was genioplasty to increase the chin. The result is not quite satisfactory. It would have been much better if there had been surgery on both jaws. She wanted surgery exclusively on the mandible. But here's the result. The result is would have been nicer if we'd done surgery on both jaws than on a single jaw. So you shouldn't hesitate to inform the patient that class 2 surgery is preferable to treat with surgery on both jaws when there's a deficit in the smile. It's going to cure sleep apnea, as you will hear later, and the aesthetic result is nicer as well. So can you get a better morphological result with surgery on both jaws? Of course. Here's another patient of Michel. This is a child, class 2, typical. The mandible is set back. We could have just advanced the mandible if we wanted proper occlusion. Having a proper occlusion is good, but having a good face is better. This is what we did. The smile is not satisfactory, and so we did a bimaxilla surgery. Did you all get this? Bimaxilla surgery, and you no longer see the smile. So the smile is better. So it's better to do surgery on both jaws rather than a single jaw. You can lower much more than you think, and I wanted to finish with this case. He was unable to come. He would have been happy, but so it's preferable to do bimaxillary surgery when the smile is unsatisfactory, and it helps sleep apnea. There are a lot of arguments in favor of that. I think that it's true that modifying the chin will put it in a much better position.